Hi there, my name is Melissa and I'm a physiotherapist here at Physiomobility. Today I'm here to talk to you about knee replacements. Knee replacements are very common amongst those who have had chronic knee pain, whether it's from osteoarthritis or rheumatoid arthritis. The surgery will kind of take place to help reduce the pain and just improve overall quality of life. There's two main streams of therapy that happens either pre or post knee replacement surgery. The first one being prehab. So you do therapy leading up to the surgery. What we would aim to do is to increase and maximize the joint range of motion as well as muscular strength, just to produce better surgical outcomes. Prehab does tend to lead to a faster recovery post-surgery. The second stream of therapy that we do for knee replacements is post-surgery. So after the surgery, our goal is mainly to manage the pain, reduce the swelling, increase the range of motion, and increase the muscular strength back to what it was at baseline. Having a therapist there to help guide you through this process is helpful, as it is a step-by-step progression.